Treatment on subclinical hypothyroidism or hypothyroidism in pregnancies. Hypothyroidism is a disease caused by decreased concentration because the thyroid gland does not produce enough thyroid hormone.
What is hypothyroidism? What it is, plain and simple, it is an underactive thyroid gland that isn't producing enough T3 and T4, which are thyroid hormones that keep our body working efficiently. How is it diagnosed? Usually a physician will order a blood test and they will look at your T3, T4, and TSH levels, which is thyroid stimulating hormone, to diagnose this. But first let's cover the pathophysiology, because in order to understand why you're seeing these certain signs and symptoms, the causes,
Treatment inconsistent on the reflex on the thyroid hormone thyroxine T3 and thyroxine T4. The drug used in levothyroxine and sodium.
Or T3 and T4. However, T4 or levothyroxine, which is the clinically used drug to replace T4, and triiodothyronine are both thyroid replacement hormones. Both levothyroxine and triiodothyronine are used to replace thyroid in the body. Clinically, they treat hypothyroidism, and more commonly though, T4 is used. And that's because, as we indicated, T3 is the stronger acting hormone.
Levothyroxine and sodium is used to treat hypothyroidism is worked by replace the thyroid hormones. Presentations: tablets 15 mcg, 100 mcg, 500 ampoules. Dose gig 1.7 mcg per kilogram per day. Application in the nursing. The nursing gives the patients and single tablets in the morning orally, with a little liquids and intravenous administration, 1.7 mcg per kilogram of weight per day.
Levothyroxine is a prescription medication used to treat an underactive thyroid. Levothyroxine is a synthetic thyroid hormone, which replaces the body's reduced levels of this natural thyroid hormone. This medication comes in tablet form and is taken once in the morning on an empty stomach with a glass of water. Common side effects of levothyroxine include tremors, a change in appetite, and irregular heartbeats. It's important not to take levothyroxine unless prescribed by a doctor. For RxWiki, I'm Teresa Brooker.
As when they help to control hypothyroidism. Levothyroxine prevents in hypothyroidism, leading to anemia, muscular pains, and preeclampsia in the pregnant women. Levothyroxine and sodium in the pregnant women reduce the risk of fetal needles death.
Are millions of follicles. These follicles produce hormones, which are used by every cell of the body. Inside the follicle.
Disadvantage: levothyroxine allows control hypothyroidism but does not cure it. Another disease need to perform. Every 6 to 8 weeks, the patient needs the daily treatment alone.
Side effects: long-term use of levothyroxine users experience minor adverse reactions that may subside without any treatment. Such side effects disappear as the body gets adjusted to the treatment. However, you must inform your healthcare provider, who can guide you with some tips to prevent or reduce such side effects, which are given below. Hair loss, headache, weakness, change in appetite, weight loss or weight gain, nervousness, depression, mood swings. These are some of the symptoms experienced by most of the users during the initial days of treatment. However, medical attention must be sought in case the symptoms persist or worsen. Allergic reactions: some people can be allergic to levothyroxine. In that case, they may experience symptoms like difficulty breathing, shortness of breath, swelling of the face and tongue, skin rash, hives, wheezing, flushing, etc. Abdominal pain, nausea, and vomiting may also develop in some cases. long-term overdose side effects, long-term use of levo.
In the Ecuador and other countries, and use state statistics on the pregnant women's 2% hypothyroidism, 18% of pregnant women are treatment and levothyroxine sodium.
More than 120 million levothyroxine prescriptions written each year. The drug's purpose is to raise low thyroid hormone levels for a condition called
Conclusions. The treatment with levothyroxine has an objective increase the expectation and improving the quality of life and the pregnancy. Women from normalization to 3 and to 4 levels. This reduces the risk of failure, as well as other complications. Thank you.